The humerus has a lot of bone markings that you'll have to know for your exam. On the left is one of my plastic bones, that's the anterior view. On the right is a real bone that show in the posterior view. So let's go over the different bone markings. I'm going to use the real bone because they're a little bit easier to see on that. The first thing you'll need to figure out for your lab test is which view of the bone that you're looking at. If you're looking at the anterior side of the bone or the posterior side of the bone, the easiest way to figure that out is to look at the bottom. This is where your elbow joint is. This is the olecranon fossa, so your elbow fits in there, so that is the posterior view of your bone. So let's talk about the anterior view first. You can see that it does not have that on this side, so we know that that's the correct facing for this. On the upper part, you can see where it actually fits into the glenoid cavity. That's the head of the bone. The anatomical neck is right here. That is where the growth plate fused. This is your greater tubercle right here. It's hard to point with one hand. This one right here. The smaller one is the lesser tubercle. You can see that they're actually bumps. You can't see that on these diagrams, and that's what makes it hard to study for this test. As you move down, this is the surgical neck of the bone, and then you can see the bump here, which is the deltoid tuberosity. So it's where the deltoid muscle attaches. Then down at the bottom, let's flip it right. This is your lateral surface, so this is the lateral epicondyle. I'm going to set it down. So your lateral epicondyle is back here. This is the capitulum. This is the trochlea right here. The coronoid fossa is right here, and you can see if I pull the bone this way, you can see that that's a definite dipped in place right there. And then your medial epicondyle is on this surface. So this is the lateral surface of the bone. This is the medial surface of the bone. And you can tell that it's the medial surface of the bone because you can see where the head of the bone fits into the shoulder joint up here, and that's on the medial side. On the other side, the posterior view of the bone, we know it's the posterior view because we can see this dipped in olecranon fossa right here. This is where your elbow fits. This is the medial epicondyle again, the lateral epicondyle on this side, and the trochlea at the bottom. Your greater tubercle is on the outside, and then the surgical neck is here, the anatomical neck, and then the head of the bone. I'll show you a mnemonic for remembering your bones of the elbow joint in just a minute. Mnemonic to help you remember the elbow joint. The trochlea always articulates with the ulna, which is this one right here that goes into the cavity. That's the part of your bone that doesn't move whenever you rotate your arm. The radius articulates with the capitulum, and that's the part that actually rotates when you turn your arm. Your radius rotates, that's the easy way to remember that, and your thumb will cross, and those two bones cross when you move that. But that's an easy mnemonic for the elbow joint.